Morning, good afternoon, everybody. We're going to wait a couple more minutes, a few more people to join us before we get started. Happy you could join us today. Andrea, how are things up in Portsmouth? Are you calling from home in that area?
Yeah, I am calling from home. President Biden is in Portsmouth today, so it's kind of a big deal up here.
Oh, wow.
But we're also kind of getting the remnants of a nor'easter, so not so much snow, but we've gotten a lot of heavy wind and some rain today too. So the weather's a little wonky as well.
Yeah.
Never a dull moment in New Hampshire.
All right, just maybe another minute and then we'll get started. All right, so why don't we just do that? My name is Stephen Lester. I'm the Science Director here at the Center for Health, Environment, and Justice. CHEJ works with grassroots groups around the country dealing with toxic waste problems, toxic chemical problems. And we run this seminar series on Tuesdays, once a month, usually the third Tuesday in the month. And we're happy today to have a guest speaker, Andrea Amico from Portsmouth, New Hampshire. Before I introduce her, I have a few just logistical things I want to share with everyone. Everybody will be muted as we get started. Andrea is going to give a presentation for 20 or so minutes, and then we will open up the floor to Q&A. So everybody will have an opportunity to ask questions and share information and some of their experiences. If you have a question during the presentation, you can jot it in the chat. Caitlin, one of our interns, say hi, there you go, that's Caitlin. She's going to be monitoring the chat. Those questions can get raised again if you want directly with Andrea when she's done, or we will raise those questions from the chat after some point during the Q&A. So I think that's it on the logistics. So we can get started. Our guest speaker today is Andrea Amico from Portsmouth, New Hampshire. I had the good fortune to meet Andrea a good number of years ago. We met in a restaurant outside of some busy circle. I have family in Southern New Hampshire myself, so we got to meet, and I met some of her young leaders that were working with her at the time. And it was really a pleasure to meet her and to see even then the passion she brings to the work and her commitment to sort of addressing these questions of exposures and what we should do and how we should interpret things. And it's really, she's come a long way since those early days. And I'm quite proud to have known her in those early days. She works with an organization called Testing for Pease, and she has been involved in, I'm sure she'll tell you the details in her own personal story about how she got involved in this whole situation of these PFAS chemicals, these perfluorinated compounds. And Andrea, thank you for being with us. Welcome, and the floor is yours.
All right, thank you so much, Stephen. I'm just going to share my screen. Let's see. All right, can you guys see my slides okay?
Yes.
Okay, wonderful. Yeah, I'll just say thank you, actually, Stephen. Yeah, I think of you fondly as someone who really helped me out in the very beginning when I had no idea what I was doing. I still some days don't know what I'm doing, but I remember having calls with you frequently, and you were such a big support to me. So I really appreciate you inviting me to be here, and I'm always grateful for all the guidance you gave me early on and that we can still stay in touch. Good afternoon, everyone. My name is Andrea Amico. I am a co-founder of a PFAS community action group called Testing for Pease. It's an honor to be here today, and I appreciate the opportunity to speak with all of you about PFAS contamination from the community perspective. I have 4 main objectives I want to cover with you today in my talk. I want to start by sharing my personal story with you as a PFAS advocate. I also want to highlight some of the most pressing challenges faced by PFAS impacted communities, followed by much needed change impacted communities need to address PFAS contamination. And I want to end with some key takeaways for other community leaders who are also facing PFAS contamination. And even if it's not PFAS contamination, just key takeaways as a community organizer that can help you in your journey. So a quick background on my community. I live in Portsmouth, New Hampshire. It's a coastal city located on the seacoast region of New Hampshire. It's about 57 miles north of Boston. In Portsmouth, the Pease Air Force Base was active from 1956 to 1991. It was made up of about 4,300 acres of land. And in 1989, there was about 4,500 employees on the base, and it was a pretty robust place back in the day. It was a strategic air command center during the Cold War. In 1990, the military began leaving, and the Air Force Base closed in 1991 under the Base Realignment Closure Program. But also it's important to note in 1991, Pease was classified as a Superfund site, which is a heavily contaminated area identified by the EPA because it poses a risk to human health and or the environment. So former Air Force Base, no longer active, but redeveloped. And that's what it is today. In 1991, the Pease Trade Port started development, and the old Air Force Base was repurposed and transformed into an active business park that we know today. The Pease Trade Port is home to about 250 different types of businesses, and it used to draw about 10,000 people a day to work in these businesses. That was pre-COVID, of course. I know there's not as many businesses there as many people working on site, but there is still an active airport and Air National Guard on Pease today. And the Pease Trade Port is a large economic hub for this seacoast region of New Hampshire where I live. My husband worked for a business at Pease for about 9 years, and there's 2 large daycare facilities on the trade port that people who worked there could send their children to, and we sent our 2 older children to daycare there. So who is testing for Pease? We are a community action group. Our mission is to be a reliable resource for education and communication while advocating for a long-term health plan on behalf of those impacted by PFAS water contamination at the former Pease Air Force Base in Portsmouth, New Hampshire. I co-founded this group with 2 other women, also moms, Elena Davis and Michelle Dalton. And we formed testing for Pease after reading a newspaper article in 2014 that changed our lives forever. We learned that drinking water wells at the Pease Trade Port were contaminated with PFAS. At the time, all of our children were attending daycare together on the trade port. And as I said, my husband was working for a company there every day. Michelle was working for a company there at the trade port, and Elena had worked for a company there. She had since relocated to a different job, but her son was still attending daycare. So this was and still is a very personal issue to us and our families, especially our young children who were at this trade port daily and exposed to highly contaminated drinking water with chemicals we had never heard of before. This caused us to quickly organize and to educate ourselves and push for actions and answers to our questions. The cause of PFAS at Pease came from firefighting foam known as AFFF, or aqueous film forming foam. And this was used dating back as far back as the 1970s when Pease was an active Air Force base. They used this foam at all military bases, the DoD military bases, because it was very good at putting out petroleum-based fires. So, you know, when you have planes and things like that, they would use this to put out those fires, but they also use them a lot to train. So we saw at our base, we had, not only did we have a large known fire where they used a lot of this foam right over one of our drinking water wells, but we also have an area at the old base where they trained a lot with this foam. And, you know, I'll get into this a little bit, but it's not unique to Pease that they just use this foam here. They've actually used it. The DoD has used this, Department of Defense has used this at all of their military sites. So, and sadly, as I said, Pease is not unique or alone. We were one of the first communities in the nation to discover this serious problem. However, the Air Force and other branches of the US military use the same firefighting foam at all their sites. And it's not, but it's also important to know that this is not just a military issue. PFAS is affecting other communities too from other sources. For example, about an hour from where I live in Merrimack, New Hampshire, the community there is also dealing with PFAS contamination from a different source. An industrial polluter known as Saint-Gobain Performance Plastics is emitting PFAS in the air from their stacks and has contaminated the municipal water supply, multiple private wells, and more. The dots on this map represent other communities in America facing this issue as well. So this map is from the Environmental Working Group, and they update it a couple times a year. It's an interactive map. You can zoom in, you can zoom out, you can hover over the dots, and it will tell you more about the source. I think one thing that's been really important for me to understand, and I think for other people to know, is you look at some places on the map and they look super heavily contaminated and other places don't look as contaminated. It's not that those places aren't contaminated with PFAS, it's that some states are being more proactive in testing for it. So like in New Hampshire, our Department of Environmental Services has been testing many sources like landfills, airports, different places where they're out actively looking for PFAS, where some states are only testing where they have to. And so you may look at some states and be like, wow, that place is really heavily contaminated. I suspect if every state was as aggressive as they should be in testing, we would have many more dots on this map. And I think it's also important to mention that PFAS contamination is not just unique to the US either. It's a global issue. Japan, Italy, Germany, Sweden, Australia, and more countries around the globe are facing PFAS contamination. I think one thing that's been really inspirational to me, and it's amazing, is that I've seen communities from all over the world kind of come together and share information. I've also seen scientists from all over the world come together and share information at conferences. I've emailed with people in Sweden and Australia, and it's really great to know that there is a global community, not only of community advocates, but scientists as well, addressing this issue, and it's not unique just to us. So a few more, accomplishments for my community, going back to my community story at Pease, we've had many accomplishments since learning of our contamination in 2014. First was a PFAS blood testing program, which was offered to the Pease community in 2015 to better quantify the amount of PFAS chemicals in our blood. That was the initial thing our group was advocating for, hence the testing for Pease. We were really pushing for blood testing, and we were able to get that for our community. And also in that time, we saw multiple groups and boards form to discuss and tackle this issue that we were able to have a seat at the table on and be part of. And we successfully advocated that the Air Force filter the drinking water at Pease. The PFAS blood testing program we participated in, unfortunately, did reveal elevated levels of PFAS in our community's blood. So that leads us to the following couple years, and these blood test results left our community with a lot of questions about what PFAS exposure will mean for our health over time. So in 2017, and based on the high levels of PFAS found in the Pease community's blood, the Federal Health Agency, ATSDR, or Agency for Toxic Substances and Disease Registry, recommended a human health study at Pease. Initially, the Air Force refused to pay for the study, but thankfully our US Senator Jeanne Shaheen stepped in and wrote legislation to mandate DoD pay for the study. At that time, we also, our community group, partnered with Silent Spring Institute to develop a plan to study immune function in children in our community called the PFAS REACH Project. And also during this time frame, I was invited to testify at the first ever US Senate hearing on PFAS in DC in 2018. And I was one of 2 community members invited to attend the first EPA National Summit on PFAS in DC, and had a one-on-one meeting with Scott Pruitt, the head of the EPA at the time under former President Trump. In 2019, I attended the President's State of the Union address with Senator Shaheen to raise awareness on PFAS issues in New Hampshire and across the nation. And in 2019, our state of New Hampshire passed some of the most protective drinking water standards for 4 PFAS chemicals in the nation at that time. Since then, we have seen some other states get even more protective than New Hampshire, but we were one of the first states to really be protective, which was something I know our community group is really proud of. We advocated strongly at the state level for that. Our group also helped to organize and present at the first and second national PFAS conferences, which took place at Northeastern and Boston in 2017 and 2019. And make note, the third national PFAS conference will be in June in North Carolina, if anybody's interested. And then 2 years ago, I was asked to give a TED Talk on my journey as a PFAS advocate. In 2021, some notable accomplishments are we continue to receive federal funding for PFAS health studies for our community, a drinking water plant at Pease that has both granular activated carbon and resin technology was completed last spring, and the effluent data showed non-detect PFAS levels in the Pease drinking water. This was all paid for by the US Air Force. Last summer, I was asked to present to the National Academy of Sciences Committee on guidance on PFAS blood testing and health outcomes on the community's perspective and what our needs are. And I helped to contribute to PFAS medical monitoring guidance and fact sheets through my role as a community partner on Silent Spring, the Silent Spring PFAS Reach project. I was also invited to testify at the US Senate hearing on PFAS again last December, excuse me. Our advocacy has accomplished a lot, and our biggest priority for the Pease community has been 2 Pease health studies that have been actively recruiting community members. So the first study is the Pease study, which is through being offered through ATSDR. It was recruiting 1,000 adults and 350 children, which will study PFAS levels and a variety of health outcomes. That study stopped recruitment in December of 2021 after being open for about 2 years. Unfortunately, it had to pause in the middle because of COVID. And we were not able to hit the recruitment numbers that we had hoped for, but we did still get almost 1,000 people through the study combined between adults and kids. And right now it's in the data analysis phase. We don't have any answers yet, but ATSDR is working on that. And the second study is called PFAS Reach, and that's a smaller study for younger children, ages 3 to 8. And that's specifically children of moms who drank water at Pease before 2014. And the focus will be on PFAS levels and immune function and looking at vaccine effectiveness. Both studies will hopefully provide meaningful answers to our community and others about PFAS exposure in humans. And one silver lining to our advocacy for health studies at Pease is that ATSDR is also conducting a multi-site health study at 7 other locations across the country. Pease is serving as the pilot model for that multi-site study, and it is our hope that with a large coordinated national health study, families like ours will get more answers about the effects on PFAS in human health. So we helped kind of lead the way for this bigger study. Some people have asked, like, how have you accomplished so much? And it's important to note our PFAS advocacy work would not have progressed or evolved without the significant support and leadership from our local, state, and federal elected officials. I can't stress enough how much our relationships and collaboration with these officials and their staff have translated into meaningful action for our community and others across the nation. We've been incredibly fortunate in New Hampshire to have very strong elected official support in helping us with our cause. Another really powerful piece of our work as advocates has been realizing that this work is bigger than just Pease and New Hampshire. We helped to form the National PFAS Contamination Coalition, which is a group of PFAS community leaders from all over the US advocating on PFAS across the nation. Our coalition members have been directly impacted by PFAS at military sites, industrial sites, landfills, firefighters exposed occupationally. The coalition formed in June of 2017, and we continue to meet regularly to educate each other, strategize, and provide support and empowerment while we work together at a national level to promote change. The coalition's main goal is we want to work towards regulation of PFAS as a class, and we want it at 1 part per trillion or less, as we feel that is the most protective standard for communities. If you are in a PFAS impacted community or you're just interested in learning more about the coalition, there is a website called pfasproject.net. The coalition we've done a lot of work in our coalition, and some of the things that members in our group have done has been testifying at government hearings on PFAS, attending and presenting at national conferences, participating in exposure assessments and health studies, and actively engaging with many levels of government, academics, scientists, non-governmental organizations, and all sectors working to address PFAS. We work tirelessly to be seen, to be heard, and to make sure our perspective and needs are at the forefront in addressing this widespread public health issue. Another great website and PFAS resource for communities to be aware of is the PFAS Exchange. You can find it at pfasexchange.org. This is an interactive website that has a map where communities can connect with one another. So this is not part of the coalition. This is through Silent Spring and their PFAS Reach project. If you live in a state where with PFAS contamination and you want to find other PFAS community groups in your state, you can check out this website and click on Connect with Other Communities. The website also has a tool that allows you to plug in PFAS water data, like from your home or your community, and also your individual PFAS blood testing data if you have access to that. And it allows you to compare your results to the national average or to other people and other communities. So that's a really great feature. And there's also some really amazing PFAS fact sheets on the PFAS Exchange that talk about medical monitoring and vaccines and things like that, just really helpful information for community groups. So I would definitely recommend that as a resource for anybody who's interested in learning more. I want to elevate some of the challenges PFAS communities face. Our biggest challenge is that PFAS is unregulated by the EPA in most states, which means we continue to be exposed to PFAS through multiple pathways. And given the large amount of PFAS in the class, and given that there's a large amount of PFAS in the whole class, communities are often exposed to a mixture of PFAS, not just one or two. Community members are often not seen or valued as critical stakeholders in meaningful discussions with decision makers. And communities bear the brunt of steep financial costs associated with PFAS exposure. So we're very fortunate at Pease where the Air Force did pay to clean up and remediate the contamination. They continue to pay, but that has definitely not been the case in many other communities across the nation. In addition to the economic impact, communities also suffer significant stress and emotional costs from being contaminated without consent and poisoned without permission. And environmental justice communities are often disproportionately impacted by PFAS contamination. The government has moved slow on taking meaningful action on PFAS, which underscores my first point that PFAS continues to be unregulated today at the national level, despite all we know about their toxicity, biopersistence, and widespread contamination in this country. And a lack of funding to address PFAS can slow down meaningful action desperately needed by impacted community members. Although I will say we are seeing that continue to change. Like, for example, in the infrastructure bill that was signed into law, there was $10 billion set aside to address PFAS contamination in the nation. That's a really big deal. And that was a very big win for communities across the nation. I think we're still waiting to see how that money is going to be used to help impacted communities, but the fact that $10 billion was set aside to address PFAS recently was a very big win for communities. Communities also face challenges when seeking guidance from their healthcare providers on PFAS blood testing and medical monitoring. Oftentimes, providers have not heard of PFAS and are not aware of their impacts to human health. Communities may hear inconsistent or minimizing messages from various government agencies, which creates confusion, and access to PFAS testing for various matrices is not easily accessible and not affordable. So even today, just trying to get a PFAS blood test and go to your doctor is a really challenging thing to do. Or if you live in a community where you know you've had high levels of PFAS exposure, and let's say you're a breastfeeding mom and you want to test your breast milk, that's a really difficult thing to obtain a test to see how much PFAS might be in your breast milk. So we have a lot more ways to go to make blood testing and PFAS testing in general more accessible and affordable to people. Given so many government agencies are involved when addressing PFAS contamination, it can be difficult to streamline communication to communities. A harsh reality for communities is that the people responsible for the contamination have significant resources to influence key decision makers and interfere with meaningful action needed by communities. We've definitely seen that. For far too long, PFAS has been given the benefit of the doubt over public health, and the burden has fallen on the communities exposed to these chemicals to prove the chemicals cause harm. This is a backwards approach, and one that has caused a significant amount of damage to communities all across our nation and beyond. There is a huge lesson to be learned here in terms of how PFAS was allowed to get kind of this out of hand. You know, we're to the point where we're all at some levels exposed to PFAS, some communities a lot more than others, but this has become a global contamination issue of forever chemicals. And we should have done a lot more, a lot sooner to stop these chemicals from becoming more prevalent in our environment. PFAS communities have many needs. First and foremost, we need PFAS to be strictly regulated to stop the ongoing exposure to communities. Some ways to do this are to classify PFAS as a hazardous substance and regulate PFAS as a class and not one or a few compounds at a time. If this is done, it will also put mechanisms and funding in place to fund and remediate the current contamination. We must make polluters pay the financial costs of this widespread issue. The companies who created and profited off these chemicals are responsible for widespread global contamination of forever chemicals and absolutely should bear significant responsibility in the costs associated to address PFAS. We also need to improve access to low cost or no cost PFAS testing of blood, water, air, breast milk, and more. And communities need access to biomonitoring, medical monitoring, and health studies to advance the science on human health effects. We need comprehensive outreach and education to healthcare providers in exposed areas to provide the knowledge and tools to allow communities to know what their PFAS blood levels are and to empower them to make changes to reduce their exposure and work with their doctors to prevent chronic illness and devastating health effects. We need expanded analytical methods to look for more PFAS so we have a broader picture of how many PFAS may be present in samples. And we need regulations to stop allowing new PFAS onto the market. We don't have a good handle on the thousands of PFAS chemicals already in our environment, so it's irresponsible to allow new PFAS into the market. And in that same vein, all products containing PFAS should be adequately labeled to inform consumers. We need the development and implementation of PFAS-free firefighting foams and PFAS-free firefighting gear to reduce the already high exposure firefighters experience in their occupation. And we must prioritize taking action now based on the science we have today. Communities have been exposed for decades, some families for multiple generations. We cannot wait any longer for our government agencies to take real and meaningful action. So just because this issue has become more prevalent, since 2010, 2014, the reality is the contamination has been there for decades. So people have been exposed this whole time. So we need to act on what we know now. There's still a lot more we need to learn, but the kind of waiting for more information, that's run its course. It's time to make more meaningful actions. And lastly, communities must be seen as critical stakeholders and key decision makers in how we address PFAS in our countries. When communities are valued and given a seat at the table to develop collaborative and respectful relationships with stakeholders, so much can be done to help those impacted by PFAS. We have a saying in our coalition, nothing about us without us. So some key takeaways for folks who may be community advocates, people interested in PFAS. What would I say to someone who's also trying to organize and make a change in their community? Community advocacy is a marathon and not a sprint. So pace yourself. Like I've been at this since 2014. It's exhausting and I can't do everything in one night or everything in 1 month. I just have to take it, a little bit at a time, take breaks when I need it, and rely on the other networks of people that I have built relationships with. You don't need 100 people to make a big difference. At first I thought, well, geez, we're just a couple of moms, how they're not going to listen to us. No, that's not true. Find a few key leaders in your group where you're like-minded and you get along and you respect each other and you organize, prioritize, and advocate together. It really doesn't take a large amount of people to get a lot done. You don't need a lot of experience or specialized education. So I'm an occupational therapist by training. I work in healthcare. I've never been an environmental advocate. I don't have any training in that. My family wasn't active politically. I learned all of this as I went. And I think one thing that I'll never forget, Stephen used to say to me all the time when we would talk, he's like, your instincts are right. Follow your instincts. And I would just say, you know what your community needs. You know what your family needs. Follow those instincts, stay true to your fight, and it will guide you along the way. You'll make mistakes, but you'll learn a lot and you'll grow a lot as a person too. Some other things that have really helped our community as well as other PFAS communities, build relationships with scientists. As I said, there's a lot of them out there now. There's people globally that we talk to. There's people within the US that we just are key scientists that really help us. They help us understand the science, break down technical information. They've presented to our community when we've wanted more, scientific information shared with the community or shared with officials. So That's a key component to your organizing. Also, building relationships with elected officials and their staff. That also has been critically important in helping us get funding and legislation to really make a difference. And what I'll say with the elected officials is like, that takes time. You know, you're not just going to call up and all of a sudden be best friends with your senator staffer. Like, you got to keep calling. You got to invite them to your meetings. You got to send them email updates and tell them what's going on. So just really, put the time in to build those relationships. It does pay off in the end, for sure. And then lastly, we use the media to help spread the word, educate the public, and hold leaders accountable. In our community, it was very slow going in the beginning. No one, the government didn't know what to say to us. We wanted PFAS blood testing, and, they didn't want to do it. And so we went to the newspaper and they wrote an article like, "Mom's upset about kids being exposed to contaminated water." That didn't look good, so have the media help get your message out there. It really does help educate the public, and it holds our leaders responsible too. So with that, I just want to say thank you very much for listening. A quote that we've always been really inspired by here at Testing for Pease: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." So I really appreciate you listening to me today, and I'd be happy to take any questions that you may have.
Thank you, Andrea. Really good key closing comments and suggestions and advice for people. I couldn't say it better myself. So really key things. It is a sprint. It is a marathon. It is not a sprint. So you're absolutely right about that. So let's open it up to questions. I have a couple, but I'm not going to jump in. I'm going to let you folks have that time. So does anybody want to be the first? You can come off mute, raise your hand, or give some indication so we can try to manage this a little bit. That would be great. All right, Tony, you go first.
Yeah, my question is, we have a military base that was shut down earlier in the 2000s.
Excuse me, Tony, could you just say where you're from, what town?
I'm sorry, I'm in Interlake, and I'm in the Finger Lakes of New York, not far from Love Canal. Anyway, the military base was shut down. And I guess my question is, how much of a source of PFAS are military installations? I mean, you talked about your struggles with the Air Force.
Mm-hmm. Yeah, so that AFFF, that aqueous foam pouring foam, we do know that all branches of the military use that foam at their installation. So again, depending on the type of installation, so for example, at an Air Force base, we know they absolutely used it to put out a very large plane fire back in the early 1990s, but we also know they trained with it. So I'm not sure what branch of the military, but the map that I included, that environmental working group map, that's a good resource to first start. You can kind of go to that map and zoom in and look at your region, and you can click to see. The military is in the process of sampling all of their installations, both active and former, to test for PFAS contamination. What's been challenging sometimes with DoD is that they haven't always released all of the information. So again, I talked a little bit about how we don't have a lot of regulations on PFAS. So right now the EPA has advisories on just two PFAS, PFOA and PFOS. So what I have found is that DoD tends to just report what they find on the PFOA and PFOS, but the reality is there's multiple PFAS that was used in these foams, but because there's no regulations or advisories on the other PFAS used, they may test for it, but they don't always openly share that with the community. That's something when I testified at the Senate in December, I really pushed for more transparency from DoD, because it's important that they test and they find out if they have caused contamination, historical contamination, but it's also critically important that they share all the data that they find, because I know for myself, like my kids didn't just drink PFOA and PFOS, they drank a mixture of PFAS from that foam. I care about all the PFAS that's in their body and that they drank, and I should know all the PFAS that the DoD is finding in the environment, regardless of advisories or regulations. So that's kind of a long-winded answer, but I would recommend looking at that environmental working group map and seeing if your community has been tested. There also, environmental working group has been tracking the military's work on investigating and addressing PFAS. They're also a very good resource. And certainly you can reach out to me at Testing for Pease too. If you're struggling to find that information, I can work to try to help you more to locate
Yeah,
that.
thank you. It was a former Air Force facility when the B-29s were pulled out. Anyway, it opened up a kind of Pandora's box, but nobody is talking about it anymore. I'm a village trustee, and so I'm also a member of a watershed organization. So at any rate, I want to be able to push our county and the region to look into this. But thank you very much, Andrea.
Yeah, of course. I think it'd be important to know, like, have they tested for PFAS in the groundwater? And if, I don't know your region, are there homes surrounding that area that draw their water from nearby? Like here in Portsmouth at Pease, we have 3 municipal wells that draw the water for the larger system, but then there's a town right next door to the base where there's been private drinking water wells also impacted. So we not only have municipal contamination, but the PFAS has migrated off the old base and affected some of the communities surrounding the base as well. So that would be really important questions to ask, like, not only have they tested, but how far have they tested, and is this impacting people even surrounding that former area?
Okay, I'm going to jump in right now. We do have some questions in the chat. Ali Carlson has asked, what is the total annual budget for your work and what does it take?
Yeah, so good question. We don't have a budget. We're not like a nonprofit. We don't have a bank account. We have applied for grants over the years to do like some additional water testing and things like that, but we don't have a budget. We're not paid. We don't actively pursue funds like to do this work. So a lot of it has just been our own time and our own resources. So like we have a website that we have an annual fee that we have to pay. And so we just pay that out of pocket. We have folks that help us, update social media. We have, my husband's a web designer, so he helped us make the website. So honestly, like you can do this with minimal resources. I think the biggest resource that it takes is your time, which frankly is really invaluable, especially when you have a family and you have little kids and you have a job. But you just have to prioritize like what is important to you and set aside that time. And again, it goes back to that notion, like this is a marathon, not a sprint. So, you don't need to put 40 hours a week towards this. You can chip away at it bit by bit over a long period of time, and you're going to make meaningful action. And you can, certainly having money helps for sure, because there are some costs, but you can also do it with minimal money and just your time and asking others to have skills that can help you, like web skills, social media skills, things like that.
Can I interrupt? It's Ali Carlson, just responding to that.
Sure.
So do you have a fiscal sponsor? So if you did have costs like testing that you needed to do, does your project have a fiscal sponsor, and should you say that?
Yeah, so we have had a fiscal sponsor in the past. We don't currently have one, but there's a local organizing group. It used to be called Toxic Action Center, and now they're called Community Action Works. They're up here in the New England region. So they have helped us at times when we applied for grants to do some additional PFAS testing that the routine testing that was being done here wasn't capturing some more expansive methods. So they helped us apply for some grants, and they received the funds on our behalf and then paid for the testing on our behalf. So we did work with them at one point in time, but they're currently not a fiscal sponsor. We don't have any active funds that they're managing or that we have.
Okay, let's take another question from the group. Great question. Anybody else want to raise their hand? And otherwise we'll go back to the chat. All right, Caitlin, pull the next one out of the chat.
Okay, perfect. We have another question from Marianne. It is, what's the best method for deciding where to test in our community to characterize the spread of off-site contamination? Land, waterways, air. We have an industrial center where PFAS has been found.
Okay, yeah, so I'd probably need a little bit more information about that, but I think it's first trying to identify a source, like if you have an industrial source, better understanding that. So like, for example, here at Pease, our source was the military and it was firefighting foam. So specifically, it was sprayed on the foam and seeped into the ground. So they looked at groundwater, then they tested drinking water wells. And then now we're at the phase where we've been at this for so long, the Air Force has now started testing beyond drinking water and groundwater. Now they're testing soil, shellfish, plants. You know, we're moving beyond, we're doing a more expanded investigation. If you're in, but in Merrimack, New Hampshire, like I mentioned in my talk, an hour away, they have PFAS contamination, but it's from a factory, a St. Gobain Performance Plastics factory, and they emit they coat textiles and they emit the PFAS in the air. It goes airborne, comes down onto the ground, seeps into the groundwater and contaminates the environment. So in that particular community, I'm not immediately involved in their work, but I'm familiar with it. And, they are concerned about airborne emissions and PFAS in the air. They're also concerned about surface water and local rivers and lakes. And they're also concerned about the groundwater contamination that it's also seeped in. So I think it's important to identify what type of source you're dealing with and how it's actually getting into the environment. And then, starting with like your local water supplier and asking, have you tested for these contaminants? Have you found them? And then also your state environmental agencies. So in New Hampshire, we have the Department of Environmental Services. Some states call them DEQ or DEP, or, whoever your state agency is. It would also be important to reach out to them too and ask them, where have you done investigations on PFAS? How many PFAS have you tested for? What have you found? Are there any local sources in my community? Again, some states are much more proactive and progressive in testing than others. If you find yourself in a state that hasn't tested very much, certainly advocate for that, and some key like hot spots that we know of, again, military bases, because we know they use the foam. Airports also trained with this firefighting foam. So a lot of airports have found contamination. Landfills, we've seen it here in New Hampshire, many landfills with higher levels of PFAS around the landfills. And also like, again, industrial sources like factories, some other places that you might not even think about, like car washes. We've seen them here because it's in the wax, the car wash wax and things like that. So, and sadly, there's a lot of sources of PFAS. And if you hear someone who says, don't worry, we don't have a PFAS issue here, it's unfortunately, we all have a PFAS issue. It's just, you have to look for it. So.
Can I just add, hi, I'm Marianne. Thank you very much. This is fascinating. And we're just trying to get started with a project here in New Jersey.
Okay.
And so we're also looking to see how it's affecting the watershed, right? In addition to the drain. So we think we know that there's an industrial site. We're also concerned, and I'm really happy to see that, to hear that you mentioned soil, shellfish, and plants, because that's the nature of our partner organization's interest.
Okay.
So how do what's the best way to kind of characterize, how it's getting from that on-site source that we think we know about to the rest of the watershed? How do we know? Obviously there's a lot of dots to connect, but do we test rivers to see if it's going down? Do we test any kind of waterway we have access to?
Yeah, again, like here at Pease, we work with the Air Force. There's hydrogeologists. They look at the flow of the water and how it's flowing, and then they decide how to test from there. Without like understanding your specific area, I'm not sure what to say, but I think your best bet, New Jersey, I think, has been very active on the PFAS front. There's a Drinking Water Quality Institute within New Jersey that have put out a lot of really good information on PFAS. I would say start with your state folks and talk to them more about what testing have they already done, and talk about, again, without understanding how the water flows from rivers or whatnot. I think you need someone who can understand the flow of the water, and then you can come up with the plan for testing. But yeah, it's important eventually to test all of those things. But in terms of how to prioritize it, it needs to be specific to your site. Hydrogeologists can help. Your state, starting with your state folks to see what they've done already. So you're not reinventing the wheel or retesting something there's already data on. That's where I would start.
Excellent. Thank you very much.
Sure.
Anybody else? Well, Andrea, let me ask a question.
Sure.
You mentioned the goals of one of the coalitions to set 1 part per trillion as a drinking water standard. Can you give us a little update on where the national efforts are to get EPA to actually set a drinking water standard as opposed to the advisory?
Sure, yeah. So we have seen with this new administration under Michael Regan, they have put out an updated PFAS action plan. And it is my understanding that they are working towards setting MCLs for some PFAS. But there has not been significant headway made in regulating all PFAS as a class. So we are seeing this EPA take good steps in the right direction to first just set some enforceable standards, because right now we don't have those at all. So there is talk of doing that in the near future under this EPA. But again, like I said, it doesn't go far enough in terms of class regulation and protecting us from all PFAS, unfortunately.
Yeah. Great, thanks. Other questions?
Stephen,
Yeah.
there is a question from Derry Sickler.
Yes. Okay, I think I'm unmuted. Yes.
Yep, I can hear you.
Oh, great. Thank you. I have a nonprofit that focuses on the fun issue of sewage waste. And if anybody's been following the issue with farmers like Fred Stone in Maine, the PFAS is coming from the sewage waste, which is dumped on the farmland and then either washes down into the water or has a plant uptake. And I feel like we don't address that enough as organizations. Not to be disrespectful, but not everyone lives near an Air Force base, but everybody eats food. And like in the Salinas Valley in California and in Arizona, they use sewage effluents as irrigation. So we're pouring this PFAS laden sewage waste as a fertilizer, irrigating crops. And even the EPA's own studies have found plant uptake of the PFAS. And I feel like we can, that needs an awareness. I was at the 2019 conference, which was wonderful. I felt like a little beam came out of the sky when on the at the front they said, yes, PFAS is found in sewage waste. I felt like the clouds had parted. I've been working on this for 12 years. So I would love some ways for people to get behind saying we shouldn't be pouring our sewage waste. I'm in Pennsylvania, for instance, in the heart of Lancaster, where everyone loves to go past the horse and buggies. The sewage waste is brought in from military bases.
Mm-hmm.
And then it's poured on farmlands that grows our food.
Mm-hmm.
And I feel like we could, if we were highlighting that even more, like, look what happens with people who live near military bases or are highly exposed, but we've got a drip exposure in our food source all the time.
Mm-hmm. No, I completely agree. I think one thing that I often say is like PFAS is like an onion. I just feel like we constantly are pulling back more layers. When our contamination was first discovered, it was like, oh my God, it's in the drinking water. And you're absolutely right. Like, as it's continued to evolve and we've learned more, it's like, oh my gosh, it's in some communities, it's in the air. In some communities, it's sludge that's been spread over farms. It's contaminated cow's milk and plants and the drinking water in those communities. We also know it's in food packaging. It has, for those folks that, that aren't super familiar with PFAS, they're oil resistant and grease resistant. So they're in lots of different consumer products and food packaging. So you're absolutely right. We're all being exposed through many different pathways, some communities more than others, depending on the source. And they all deserve to be addressed and have attention. And I think that is something we have seen. You're right. I think in terms of the agriculture aspect of it and the farming, there's definitely been more awareness in the last couple of years over it, on it, versus before it was like this big focus on drinking water. And, here in our community, it's starting to understand, like, how is this affecting fish and shellfish that people eat too? It's not just the water they drink, it's now the food that they're eating. So it's having a big ripple effect. And I think what I can say is, just like I said, I really hope there's a lesson to be learned here. I mean, there was a lot that could have been done a lot sooner to regulate these compounds, to not allow them to be put into our environment. But yet we didn't. There are many missed opportunities along the way. And here we are dealing with this widespread forever chemical contamination across our entire nation and globe. And we have advocates just trying to work to bring more awareness and get more funding, and that $10 billion in the infrastructure package, that's huge. It's not enough. It won't address all of our issues, but it's a good step in the right direction. Bit by bit, we continue to make progress.
Yeah, well, thank you. And definitely, I would love to see more focus on that, again, because everybody eats. And if it's a bioaccumulative, we know that if it's in your carrots and then it's in your fish and then it's in your milk, we're constantly pulling this into our bodies. So unfortunately, the agriculture business is highly influenced by the waste industry. And the main legislators who are paying attention, just like your legislators from your community, they say the pushback of other states is we don't have a problem.
Mm-hmm.
And that's not true. Every state has a way that they dispose of their sewage waste, and the cheapest way is to pour it on a farm field. So thanks for giving me this spot to speak. And definitely, if you need anyone to talk about it, I'm the crap crusader. So
okay.
Thank you so much.
Thanks.
Let's go next to the chat. I think Caitlin has a question, and then we'll go to Allie Carson, who's got her hand raised.
Yes. So Elaine Tanner asked in the chat, she said, we are holding state water testing certification trainings. What should we advocate for to be tested?
So state water certification trainings, I'm sorry, could you be more specific? Is that for your state regulators or is that for community groups? So I'm not understanding that part of it. Well, I guess, why don't I just say, in terms of like, if I think what I'm understanding is maybe you're asking what PFAS to test for, or, so I would say having the most expansive testing that you can have done is important, because again, PFAS is a class of thousands of chemicals. So depending on the test, you may just look for 10 or 15 or 30, and that'll give you, a small snapshot of what may actually be there. And that's, again, part of the challenge that I highlighted. The analytical methods, the amount of PFAS we can test for is limited. It continues to grow as the science advances, but there are different types of testing that can be done. There's different EPA methods that can be done that most commercial labs or lab certified to test for PFAS can do. But there's also some more like Eurofins, for example, is a lab that currently last summer came out with a test where they can test for 70 PFAS. There's also, so I would say trying to get the most expansive test that you can is important to make sure you're capturing all the PFAS that you possibly can. There's also other types of testing like non-target analysis, which looks for a bigger window. It's not targeted compounds, but they can tell you if there's some PFAS in there that they maybe haven't even been identified yet. There's total fluorine tests. So there's a lot. I guess it's just trying to be as comprehensive as possible to look for as many PFAS as possible. And without having more context, I can't really give more than that.
Great. Okay, Allie, you're next.
Yeah, I just wanted to quickly comment. Doree, thank you for your comment about that. And I mentioned in the chat an article in the New York Times. I'm looking for it now, and I'll share the link if I can find it before the end of this call. But for those of you who are concerned about this phenomenon of spreading sewage sludge, it would be a helpful piece for you. It's about a couple who lost their organic farm, their dream farm, when they could no longer sell their food because there was so much contamination in the food from the sewage sludge that had been laid down decades before by a previous owner. I'm looking for the link, but if you can arm yourself with that, it's an enraging article.
Okay, other questions? Or are we back to the chat?
I have another question. This
Be
is
quick,
really
'cause I know
fast.
yeah, just be quick because you've already spoken, please.
Okay, what's the best way to get other organizations on board, or organizations that do nothing, have nothing to do with environmental health and contaminants, like so social services organizations, for example?
Yeah, I mean, it's a tricky one. I think PFAS, again, there's more awareness, there's more knowledge around it. I think there's more, like when I first started, no one wanted to even accept that PFAS caused health effects. It was like, oh, we just don't know. I think the fact, like one thing that we've seen is, or we've tried to provide education in our community is to pediatricians and OBGYNs, like PFAS cross the placenta, they go into breast milk. There's multiple adverse health effects associated with PFAS exposure, whether it's different types of cancer, immune function. You know, I think specifically when you look at the global pandemic and we're all relying on vaccines to try to help us get out of this, and we know that there's been studies that show that PFAS can reduce the effectiveness of some vaccines. There hasn't been studies on COVID vaccines, but knowing that PFAS can impact immune function and suppress immune function, and it's a widespread issue as we face a global pandemic, that's pretty concerning. You know, whether you're in a highly impacted community or, as others have said, we're all exposed at some level. So I think trying to focus on the health impacts, the fact that this passes the placenta, it's going to affect multiple generations. It affects unborn babies, you know, unborn babies are exposed, and that these chemicals are never going away. They're persistent, they're forever. This isn't something that we're all just going to kind of, you know, die in 20, 40, 50 years, and then it'll be gone and we won't have to worry about it. Like this is going to be a generation, multiple generation issue. And so we have to get behind it. And so I think depending on the organization you're trying to target, focusing on the health effects, focusing on the long-term generational impacts, to any developmental delays, immune suppression during a pandemic, just those are just a few that came to my mind.
Thank you.
Great. Okay, I think we have time for one, maybe two more questions. So Caitlin, why don't you take one from the chat?
Yes, we're gonna jump back to Arnie in the chat, asked, can you discuss upcoming significant PFAS developments, policies, regulations by the EPA, DOD to watch, comment, educate congressionals, etc. An example would be regulating drinking water, MCL hazardous substance designation, DOD more transparent and engaged communities, etc.
Okay.
There's a lot in there. I think
a long one.
You know, one of the things I can say, like I touched upon a little bit with the EPA, is that they did revise their PFAS action plan under Michael Regan, the EPA administrator for this administration. You know, there is talk of setting MCLs for some PFAS, which again is a good step in the right direction, but it certainly is not, it doesn't go far enough if we're not regulating as a class. In terms of the DOD front, I know that there's been, you know, a lot of congressional awareness on DOD to push them to test their current informal installations, to release that information to the surrounding communities. And I know there's been a big emphasis, at least I know in some of the work that I've done with DOD, to really push them to partner better with impacted communities, because right now there hasn't been a great relationship with DOD and PFAS communities. There's been a very tense relationship at times where communities feel like they don't get fully transparent information. They don't see the DOD working fast enough to address the, you know, to test and to clean up. DOD often defers to the lack of EPA regulations as a reason why they can't do more. And so I really, on the DOD side of things, really want to see much more improvement in community engagement. For anyone that is part of a DOD community that's been impacted by PFAS, DOD has been running community engagement meetings the last, not quite a year, quarterly. So, and they've taken some feedback from communities to improve those engagements and try to make those meetings more meaningful. Because at the end of the day, what I stressed is that communities need a seat at the table, and we need to be part of the decisions that are being made. And that means we have to be respected. We have to be given the opportunity to share with key leaders what the problems are and what the solutions are that we need. So lots more work to be done, but bit by bit, we're trying to work with the right people to continue to advocate for what PFAS communities need.
Great. Okay, we have 1 minute left. Does anybody else have a short burning question? I saw a couple of hands earlier. They seem to be gone. Danielle, you got the last question, if you would.
Hi, thank you. This was an amazing presentation. I'm here in Texas, and I noticed that only Ellington Airfield was on the map that you provided in the AG site. We're testing with TAMU. We're near Union Pacific Railroads because we're at the Port of Houston. How do we get all the data from Katy, Houston, Texas, Beaumont, Texas, Port Arthur, Texas, like all the Southeast region, all that into your database? Who do we contact?
Yeah, so that map, that interactive map, so, and you're talking about the EWG, the Environmental Working Group, so that's them. They're the ones collecting that data. You should be able to go to their website and contact them. But if you can reach out to me at Testing for Pease too, like info@testingforpease.com. I can help put you in touch with the EWG people, but that's not like our coalition map or anything. That's just a good tool. And absolutely, if you find that you have information that's not shared on that map, certainly reach out to them so they can include it.
Awesome, thank you.
Sure.
Great. All right, I think we have to wrap up now. We're at our time at 1 o'clock. Andrea, thank you so much for your presentation and your response to these questions. There's a whole lot more in the chat. If I can so ask if we can put those questions to you, and then you could respond if you can to them, that would be great.
Sure. Yeah, I'm not sure how to save the chat, so if you could just send it to me, I
Yeah,
can go through them and see.
we'll do that. We'll do that. Yeah.
Okay.
So thank you again. I just want to say our next training call will feature Dr. Linda Birnbaum, who's going to come and have a conversation with us. So all of you will have the opportunity to ask your questions of Linda Birnbaum. She was the former director of the National Institute of Environmental Health Sciences. She can talk about PFAS. She can talk about dioxin. She can talk about women scientists. She can cover a lot of ground. And so she will be our next speaker. So thank you again, all of you, for attending, for being here. Thank you, Andrea, again, as well, for being a part of this. And we wish you well. Take care, all.
Thank you, everybody.
Bye-bye.
Bye.